Okay, so what we're going to do is look at the three blood vessels: arteries, veins, and capillaries. Right, an artery takes blood away from the heart. So anything that takes blood away from the heart is an artery. There's one exception, but we'll deal with that when we come across it. Veins. So a vein will take blood back to the heart. This is the simplest way of looking at it. And now capillaries, what they do is they take blood through the organs. As simple as that. So let's quickly go through that. Arteries take blood away from the heart. Veins take blood back to the heart. Capillaries take blood through organs. So let's look at the arteries. Right, there's a few things you need to know. There's the artery, it's like a tube, and it's got a small opening there, a small lumen. So let's start writing down. So you've got a thick muscular wall, so that's one of the features. It has a thick muscular wall. Next bit, if you look at this opening, it has a small lumen or a small central cavity. Right, why do we need a thick muscular wall? Because blood is pumped at high pressure. So let's get this right. So it's pumped at high pressure. So what happens, the wall has to be able to withstand the pressure and return back to its original shape. Original shape and size. Just put size. So that's why it needs that. And we've got a small lumen to allow the room for the muscular wall, plus the pressure of the blood forces the blood through from the heart. And remember, it's the left ventricle that pushes the blood through. So let me just get this. So blood is flowing in that direction. It's going in that direction. Okay. Now let's look at the vein. So veins bring blood back to the heart. Again, here's a tube. if you notice, it's got a thinner wall and a larger lumen. So let's write that down. There's a thin wall and a large central cavity, but we're going to just call it, it has a large lumen. It's also got one more feature, this has. It's got valves. So just imagine that's a valve. So the blood is flowing that way. It flows through there, no problem, because the valve's open. But if it tries to flow back, it will stop the flow of blood. So let's write that down. So it has valves to stop backflow of blood. So these three things you've got to know. Right, there's something else that often crops up. Why would you take blood from a vein and not an artery? First of all, it has a thin wall, so there's less damage and less injury when you're taking blood. Thin wall. It's got a large lumen, so it's easier to get the needle in and get blood drawn out. It's got a large lumen. And thirdly, it's close to the surface of the skin, so there's less damage and it's easier to see. So it's easier to see. So that question comes up. Why would you use a vein instead of an artery? And you can apply the opposite with the vein. So it's got a thin wall, large lumen, and it has valves to stop backflow of blood. Right, finally we've got capillaries. So the third blood vessel is a capillary. Or capillaries. Right, so that's singular, that's plural. Right, okay. So what are the features? Again, look. Because capillaries take blood through organs, they have to be very, very small. Right, so if that's a red blood cell, that's how big a capillary would be. It's just enough to allow, so the lumen is slightly bigger than the red blood cell. And the reason it's so small is because it has to get through organs, so it doesn't, or it shouldn't take up lots of room. So first of all, right, it is very small in size, a small diameter. Right, secondly, it's got a wall, I have to write this sideways, a wall that, let me get rid of that, a wall that is 1 cell thick. Right, it's permeable to allow oxygen, so let me get this right. So if you've got, let's just say for argument's sake, that's oxygen attached to it, it has to allow the oxygen to diffuse out to the organ so it can respire aerobically. So let's get this right. Number 3, it has, because it's got a thin wall and it's permeable, so permeable wall, it has a short diffusion distance. Let me get this right. diffusion distance. It has a short diffusion distance for the movement of oxygen. Yeah, for oxygen to diffuse across. So all these features make it suitable for its purpose, where it's going to transfer oxygen to the organs that it's going through. So what are the features? It's very small to allow it to get into delicate organs. It's got a thin cell wall. It's only one cell wall. It's only one cell thick. The cell wall is permeable, and the fact that it's one cell thick, it creates a short diffusion distance for the oxygen to transfer across.